Then we come to how do you actually apply these stewardship principles to program sustainability? Well, we need to be wise of our time. We need to actually set plans and stick to the plans throughout the program. Yes, there are times when your plans need to change and you need to reassess. And we need to have those meetings and those reassessment times. But we need to be very mindful that time is of the essence. And that if we're wasting time, then we're not being good stewards of our time. And so therefore, we need to always make sure that our interactions are planned and we're able to get through the agendas. Or if we're not, then we actually set the time before we leave the meeting to then go back to that and finish that agenda. Many times we go into meetings and we don't complete the task, and we never take the time to go back and revisit what we've never completed. And then that leaves some service or some community not having a full service until we come back maybe months later and we reassess. There's also the concept of what we treasure. And what we treasure is being true to the project goals while transforming accomplishments. Noting that as you come to a project, that you may start off and you're to build 5 hospitals, but particularly in 2 of the regions where 2 of the hospitals were to go, there's now a conflict situation going on, and you need to reassess. Should you just leave and only do 3 hospitals, or should you choose 2 other regions or 1 region that needs 2 hospitals? How do we take that valuable information and apply it to our program? There's also the concept of when you're re-examining your project and the requirements and donor goals for continued relationship, our partnerships. Are we allowing our donors to dictate to us that we have to do this, but not being able to use our Christian values? Are we as Christian organizations starting to water down our programs and our messages just to meet our donor demands? Or are we staying true to our Christian faith, our treasure, and saying, no, we may not completely speak from a Christian aspect in every single meeting. We may not pray when we go into the ministry, but we can always pray in our office before we head to the ministry. How are we adapting our programs? Are we totally wiping out our faith-based, or are we trying to incorporate it? And what are some ways in which that we can do that? When we look at never losing sight of our organizational purpose, if we're going to be faith-based, we need to be faith-based. We need to always keep that at the forefront. Again, you don't have to pray at the beginning of the ministry meeting, but you can surely pray in your office before you go. There are ways that we need to look at, how do I apply this faith practically to working with others and in my communities and within my office and my programs? Again, we have the self-care, the temple. We need to be taking care of ourselves and taking care of those we serve. We're not being good stewards of our time if those who we serve, we're not actually helping them build their capacity and grow along the way. God has given us Christian resources that we need to respect. And we need to make sure that we do that by being managers and good leaders and guiders of those resources. Are we actually using our staff in the correct areas of their skill sets? Or are we just overworking everyone and just keep piling work on them and it gets done and we move on? Are we actually doing full-fledged analysis and review to come back to the core values of Christian and being a serving organization? And so as we think about those concepts of applying the stewardship principles, we have to build capacity. We have to be mindful to include this in all of our programs. We are not able to adhere to the Christian principle of being a good steward or a manager if we are not going to guide and train those who we're serving. Our faith calls us to love one another as ourselves, which means that whatever you're willing to do for yourself, you should be willing to do for those around you and those you serve. And are we as organizations keeping that in the forefront in our meetings? Or are we at times allowing the fact that the donors are cutting the funds short, so we're totally wiping out a program and we're not thinking about some of our church partners and other resources and other ways of raising funds to manage through these economic times. So those are some of the pieces that I want us to think about when we take the 7 principles of stewardship and apply them to our programs and keep them in our minds. Because just as the prior 2 presenters mentioned, I mean, we're looking at partnerships, which is relationship. How do I build new relationships that I might garner new resources, new ideas? I might be able to partner with programs who, when my program has been reduced, I'm now able to assist them and they assist us by continuing on projects that are true to our mission and our value for the organization that I'm working in. And so in these economic times, we want to think about that and really work on our Christian morals and faith and where we stand and how we apply that in our daily financial as well as program management systems that we have. Thank you.
Well, thanks to all of our presenters. This is a very eclectic talk and a very eclectic group. We have a few minutes here where we can take some questions. Could I get our speakers to take the blue chairs here? And I'll run the mic around.
I have one that is based on my father's experience. He was a missionary in China, worked with Nelson Bell in a medical program, but they also had schools there. This was in the 1930s. And along came the communists. And the communists came over and took over the hospital, but also took over the schools. And the schools were established by the church as a part of the mission program. And the challenge they were facing, actually with the hospital too, was do we keep the schools and the institutions open, but now go under communist philosophy. And actually it was quite there was a book written about this called A Foreign Devil in China. And the decision was to close the school and the hospital because this was too great a sacrifice of the principles, the reasons why the hospital were there. But the community, of course, saw this as, these are our schools. Our kids are getting educated. How can we close these schools? But I wonder, these kinds of challenges where the goals really are, the telos is really totally different. It's alien completely and not just sort of a variation.
Part of my responsibility is also trying to develop an international schools strategy for the Salvation Army. And I have to say the international health strategy is easy compared to the school strategy. Because, well, firstly, I'd say we have closed some institutions and we have been prepared to walk away at times in our history from when governments wanted to run them or changes of political regime occurred. But I think if we are not able to promote that character, the virtues that really are central to who we are, then I don't see how we can continue doing it. And I think that applies both for the schools and also for our health institutions. And in the last 5 years, we have closed some hospitals, and that is, as you say, it's a very, very painful process to go through because people are very attached to institutions. But I think that you have to be truthful to the mission, and you have to really discern very carefully what God is saying at those moments. But I think there are times when we walk away, and then there are times when those doors open and you walk back in again. And so now is not always, would be my reflection on that.
Hi, I'm Carl Stecker. I'm with Catholic Relief Services. My question's for Dean. In your presentation, you mentioned I didn't hear you mention more of an integrated approach where sometimes faith-based organizations in healthcare are running parallel to ministries of health, but there are now times where ministries of health have named prior faith-based organizations as their Ministry of Health regional hospital or district hospital. And how, could you say something more about how you bridge that gap of having formerly been uniquely faith-based and parallel to the Ministry of Health to an integrated approach and still remain faithful to your calling as a ministry when you are now almost subsumed to be a Ministry of Health site?
Yes, and for 4 years we worked in Zambia, where that is really a tension for us, and it goes on. I was just emailing last week our medical director there, who was saying, even the staff who are mainly on the civil servant payroll now, really saying, look, we work for the ministry, we work for the government of Zambia. And of course it gets more confusing because the government of Zambia claims to be a Christian government, Christian country. So it's very difficult, I think, for most people to discern any difference between what the Christian government says and what the church says. Now, I think we need to be very suspicious of Christian governments. I just sat last week watching the Queen of England, who is the head of the church. Now, these are complicated and very, very nuanced things. But for us, we have taken it seriously to talk to our staff about what our character is and what our priorities are and why we should build our relationships. And now where that has a tension with the government, let's say it's on charging patients user fees or the way that staff are remunerated, then I think you really do have to have that space for those conversations. But I think the state is a very monopolizing force. It tends to subsume. It tends to instrumentalize. So I come to those partnerships with a great deal of suspicion, but still with a strong belief that we do need to do it as much as we can. But there is a tension between a state agenda and a faith-based agenda, and I don't think it's worth trying to pretend that they're the same.
Sort of as a counterpoint to that response, I think that most governments consider both education and health care to be public goods. And most governments take these responsibilities seriously. So I think that also throws up an additional, not a barrier, but a challenge to us in terms of how we work together with governments in partnership as good stewards of the health and the education of the people of the country that we're focused on.
I wouldn't think that's a counterpoint, but because I'd endorse that. I suppose it comes back to that word telos again. How does the state see the end goal, and what do we see it? And I don't think they are mutually exclusive. They are not over there and over there, but it's also naive to think they're exactly the same. So there should be a natural dialogue between, the organizations for the public good, for the best of the people.
I think that brings to point that concept of relationship, that you cannot call yourself a faith-based organization or Christian and not be in communication. You have to have continued communication. And that will keep the specific goals of both organizations at the table in the forefront, and any challenges that come up can be addressed. But you have to make sure that you work on those positive relationships. And even if there is some negativeness in that relationship, that you foster it and try to make it positive.
Another word that really helped me was that whole Christian concept of hospitality, that deep sense of really what it means to be hospitable, not just tea and cakes, but really caring for the stranger, caring for the outsider. And of course the word hospital and hospitality are not a million miles away. So how do we have hospitable hospitals?